As COVID numbers continue to drop locally and statewide, much of the country is seeing numbers spike. We're joined now by SUNY Upstate University Hospital's Chief of Infectious Diseases, Dr. Stephen Thomas. Appreciate you being here. Got so many questions again tonight. Thanks.
Okay.
Let's go. So our numbers do look good locally and across New York State. So is this still a public health threat, or is this simply now a facilities issue? Nursing homes, senior living?
Oh, it absolutely continues to be a public health threat. Today we've had a pretty good day in Onondaga County, but, central New York continues to have people die every day of this disease. We continue to see a dozen to 2 dozen new cases. And so the virus is out there and the virus is circulating. But on the good side, what we're seeing is kind of a stable, low-level amount of transmission. And there's even some hints that maybe the overall picture is improving.
So the governor just slightly relaxed social distance gatherings from a max of 10 to a max of 25 for areas phase 3. That's most of the people watching us. Your thoughts on social gatherings? Just because we can, should we get up to 25 and have big gatherings like that?
Yeah, as an infectious disease guy and as a kind of a public health guy, I'm not sure that the actual numbers mean that much in terms of risk. To me, any gathering, large or small, of people that are outside of that family unit poses a potential risk. And so people need to remain concerned, and they need to be, and what I mean by that is, I'm not saying that people shouldn't gather, but you should be smart and you should go slow. So you should try to limit the number of people. You should make sure that people who are gathering are not ill. You should try to physically distance within that gathering if it's possible. If it's not, then people should try to wear masks. And you should, make special provisions for people that may be in higher risk categories.
Are you worried we're letting our guard down any? Because we keep hearing over and over, our numbers are good, our numbers are down. I mean, I hear people going to graduation parties, they're doing barbecues, even upcoming wedding receptions. We get lots of emails. What in this store, people not wearing masks, et cetera, et cetera. Are we letting our guard down too soon here?
Well, I don't know if we've let it down too soon necessarily. Listen, I get it. We've been at this for over 100 days. People are fatigued. It's a new season. The weather is good. People have a new mindset. But I'll tell you, people in around 19 states that are seeing huge increases in the number of cases and deaths from COVID may have had a similar attitude about a month ago. So again, I just encourage people to remember the virus is still circulating. Be smart in what you do, take provisions, be careful. And again, if you're an individual who is over 60 years of age or has medical comorbidities like diabetes and hypertension or lung disease, you may want to think very carefully about where you're going and what you're doing and how you're exposing yourself to other people who you may not know.
Governor announced over the weekend low-risk youth sports can resume July 6th. What are low risk to you, and what does that look like? Should it be just practices? Could we be traveling around playing in leagues? What do you think this looks like to you?
Yes, the CDC has a nice web page on this, and it's consistent with the things we've been talking about for the last couple of months. So contact sports would be considered high-risk sports. Lots of kids together and lots of parents together, that would be considered high risk. Certainly traveling, kids going to different parts of the state or parts of the country to travel, that would also be considered high risk. So what they're asking people to do is they get kids back into these types of activities. And it just doesn't have to be sports. It could be camp activities or things like that. If the child is not feeling well, the child should stay home. If a parent or coach is not feeling well, the parent or coach should stay home. Make sure that they have the ability to wash their hands frequently during the activity. If you can physically distance during the activity, during coaching sessions versus playing sessions, then you should do that. You should try to limit contact as much as you can within the context of whatever sport you're talking about. And again, just kind of be smart, physically distance when you can, and try to limit the contact, at least for now.
They said I can get one more in. So I ask you this often. Has anything changed with the virus? Is it gone? Did it get on a plane like the governor says it did to get here? Our numbers are lower. Did it go somewhere else? Is it less powerful, less contagious? Anything compared to where it was in early March?
Yeah, so I'm glad you bring up the plane because viruses are constantly getting on planes and in cars and on trains and boats. So viruses travel, which is why we have the problem that we have in our country right now. Some of the things that we've learned or that we're increasing our learning, the impact of people who are infected but not sick. That story continues to become more and more important. We know that a significant number of people who get infected do not get sick, and they are very good at transmitting the virus to other people. That's one. The other thing we're learning is that children also can get infected. Certainly, they can have severe disease, which we've seen. Thank God it's in a smaller number than we see in adults, but they can also transmit the infection to other people. We've learned a lot about tests. We've learned good things. We've learned some bad things. That story continues to evolve. And we continue to learn about how this virus can affect the body in so many different ways, which is why there's so many experimental trials going on right now trying to find a solution for care and treatment of people with COVID.
I will hang on to my other questions for the next time we meet, and I know it will be soon. I can't thank you enough for joining us again, Dr. Thomas. Thanks so much.